Hello viewers, thank you for tuning in yet again to Afya Jimudu TV, your health education channel. My good name is Wamadhai Jogona, a reproductive health specialist. The treatment of sexually transmitted infections in men. If you happen to contract these sexually transmitted infections, then they are likely to bring about signs and symptoms, bring about a disease, and thereby complications. And some of these signs are difficulty in passing urine. There will be pain when you are passing urine. There will be urethral discharge. There will be itching at the opening of the urethra. You might have wounds on your genitals. You might have testicular pain, a low abdominal pain. You might have trouble or problem having children. Maybe your wife is conceiving and losing the pregnancies. Your wife is unable to conceive totally. Then you might have in picture, or you must have in picture, that this might be brought about by the sexually transmitted infections. So those are just but a few of the signs and symptoms, including complications. There are many others. So when you have this illicit sexual affair, that's whereby you are likely to contract these diseases. And most of the times you'll try to avoid contracting these diseases, maybe largely by using a condom, which most of you don't know how to use properly. But even when it is used, that is the male condom, which is the most popular, what will happen is that when you use it, you will realize that, or you discover that most of the vaginal fluid will be found in your pubic region. And remember, these S.T.Is are germs, and what they are doing, they are not your enemies. They are also trying to exist, and they are very difficult to fight off. So if this vaginal fluid is going to be found in your pubic region, then you ought to clean yourself. But you cannot clean it all, because even at the hospital, before we wash the instruments that are contaminated and infected, we disinfect them. That is, we have to do away with the germs before we wash them with soap and water. So what I'm trying to put across is that these bacteria, these viruses are highly contagious. That is, they'll be found in your fingers, in your fingernails, in your pubic region, on your penile skin. It will be worse if you are not circumcised. You'll be carrying more germs. So you'll be able to transmit the same, because you have washed with soap and water, but disinfection was not there. So you will carry home the sexually transmitted infection to your partner, although the quantity of the germs will be low, but eventually it will bring about a disease. So what I'm trying to say is that even if you use soap and water, you will still carry the same to your partner. In another forum, I'll be in a capacity to tell you on how to avoid to carry these germs back at home, because you don't want your partner to get sick, neither do you want to break your family. Now, we shall narrow down to the treatment of the sexually transmitted infections. Remember that viruses have no cure, but we do have treatment for the bacteria infection that is now becoming resistant. For the treatment, we have two categories. Category 1 is for those who have pain when passing urine, those who have a urethral discharge, those who have a testicular pain. Remember, here it is confidential. You are not lying to anyone. You are not holding information. And this is for the sexually active men. that is pain when passing urine, urethral discharge, testicular pain, and there could be also a lower abdominal pain. This is the first category of patients that have a different treatment. Also remember, if your partner, that is your wife, presented at a health center or a hospital or a dispensary and they were told that they are infected and there is need for the treatment of the male partner, it is good for you to be treated for the same. Because what we have realized is that men will present themselves at the hospital or a health setup, and the common test that is usually done is the urine analysis, that is the urinalysis. And most of them leave the facility knowing that they are free from infections. These germs are also very intelligent. They don't live downstream, they live upstream. That is, they avoid the urethra, whereby they are routinely washed away by the flowing urine. They climb up to your prostate to be nourished by the seminal fluid that nourishes your sperms. So, we do not, or I'm not encouraging a situation where we are treating laboratory results. It is good for you to have the picture that not all tests that are saying that you are negative or test negative for the disease are truthful. Because an example is, supposedly you contracted HIV today, the HIV test will turn negative. And that is called the window period. It will take quite some time before you turn positive. And that's why I'm saying we are not treating laboratory results. Men will turn up at the facility, they'll have a urine analysis test carried out, and it will turn out negative. They end up without treatment, and they are not free from complications that initially I remembered to point out. So, if your partner presented at the health facility and they are told that they have an infection and there is need for the partner to be treated for the same, do not opt out. Being treated for the same will not bring about problems. You will be safer that way. So the first category of treatment is for those who have pain when passing urine, urethral discharge, testicular pain, maybe there is a low abdominal pain, and they are sexually active, including those whose partners have tested positive for what will be a sexually transmitted infection. So you will be able to get the prescription as I'm going to give you the details. The treatment for sexually transmitted infections in men, that is, for those who have pain when passing urine, a urethral discharge, a testicular pain, a lower abdominal pain, and they are known to be sexually active. Even for those who have no signs nor symptoms, but their sexual partner has tested positive for sexually transmitted infections, to get a prescription, you will send money via M-Pesa pay bill number 4067925. Account will be S.T.I. We'll send a sum of 300 Kenya shillings, and the M-Pesa pay bill is registered through Health Translated. The second category are those men who will develop ulcers in their genitals and are known to be sexually active. These ulcers could be outright wounds, or there could be a rash that is very painful. To get the treatment, you will send 350 Kenya shillings via M-Pesa paybill number 4067925. It is registered through Health Translated. The drugs that are to be found in these prescriptions are effective. The other advantage about the prescription is that it is in a legible handwriting, not our usual bad handwriting. Again, you can be able to keep the information. You'll also be able to tell whether you are allergic to any of the drugs. Remember to always get your drugs from a reliable pharmacist to avoid buying counterfeit drugs. At all times, remember not to substitute the drugs. Thank you. See you in our next health educative shows. Please remember to subscribe, comment, and share.